what's up everybody? Welcome back to my channel. My name is Tamisha, also known as Mrs. Coda. So today I'm going to talk about how to train your patient after they had an amputation. All right, so if this is a topic of interest and you want to learn more, please stay tuned. So in this video, I'm going to talk about post-operative care and what you can do in your role as a CODA to support this patient. I'm going to particularly talk about lower extremity amputation. Of course, there's upper extremity, but today I'm going to really talk about lower amputations, which is quite oftenly seen. A lot of times it can be due to an accident or diabetic condition. Okay, so the first thing I want to talk about is stump care. So this is your skin hygiene, and this is something that can be also supported with nursing. Nursing usually is going to be one to kind of perform the skin hygiene of a freshly cased after they went through the amputation. So you really don't really have to worry about that, but you are just kind of talking about the importance of daily hygiene, the importance of gently using water and wiping that stump. Nursing may have certain, medication they're putting there that is not really in your scope. So your focus is really just, skin checking, making sure the hygiene is well, when it comes to the sock that's being provided. And so I don't go ahead, we'll just say that first thing that you want to work on in teaching your patient is stump care as well as skin hygiene. It's often important when you're doing skin hygiene that you use soap and water once the stump is completely healed up. Just soap and water is perfectly fine. Use a wash rag, and you just want to make sure that you lather it up nicely and you wash it off with some water. You also want to make sure that once you do get your prosthesis, that you also keep that nice and clean, as well as your liners. You want to keep those nice and clean and fresh. It's always good to have more than one, as well as a sock, just so you can easily rotate them between hygiene care. So the next important thing is stump wrapping. Okay, I did a lot of stump wrappings for nursing because some nurses just really struggle with this. I'm not really sure why, but some of them really do. And that's okay. That's why we're here, to support them. And a lot of times when I talk from a skilled nursing background, because that is really my niche. Okay. But when you're doing stump wrapping, you want to work on figure 8. If you've never seen figure 8, I implore you to go ahead and check out a video that shows you how to do figure 8 stump wrapping. That can be very helpful, and it's a good skill to learn. And the reason for this is because you want to be able to have that nice kind of cone. I don't know if I want to say the word cone, but a nice curvature of the stump in preparation for prosthetic training. It's important through wrapping, it develops that nice, cup cone kind of curvature that we look for. You know what? I'm going to give you a picture right here so you can see what that curvature should look like. Okay. The next thing you want to teach your patient is range of motion exercises for this stump. A lot of times if you're working in a skilled nursing facility, this is where your PTs are going to come in, but you can also support them by making sure that, the follow through with the proper exercises, especially if it is a below knee amputation. You're going to want to have them work on, being able to press down into the bed and release, press down and release. You're also looking to make sure there's no contractures. So this is why it's important to do range of motion exercises. If you guys want to know more about range of motion exercises pertaining to lower amputation, just leave a comment below and I'll do a separate video to kind of focusing more about the exercise and the stretching portion of stump care. So the next one we want to talk about is wear schedule. Just so you understand the difference between a liner and a shrinker, a liner is what you put on first before you put on your prosthetic, whereas a shrinker is often what new amputees will get that is meant to decrease edema because after a new amputation, there's swelling that happens. So the shrinker is meant to help control that pain, help to control the edema, so you can have that nice curvature. So when it's time for you to have that prosthetic training, you're going to move on and use your sock or your liner. Okay, so let's look at some definitions here. So a shrinker. A shrinker is a soft compression garment that helps to control swelling. New amputees should wear their shrinker whenever they are not wearing their prosthesis. The liner is a gel sock that you put on your limb first before you put on your prosthesis. Two common types are a cushion gel liner or a pin locking liner. Now, the gel liner must be cleaned with soap and water daily and disinfected weekly with rubbing alcohol. And then you have socks. So your limb changes every day, okay? But your prosthesis does not change. So to manage the change, you will be given socks to wear. Socks come in different thicknesses. So you have 1 ply, 3 ply, and 5 ply, depending on the amount of cushioning required for a good prosthetic fit. So the liner goes over the skin first, and then the sock goes over the liner. Okay, so I hope that this was helpful. Let's continue on. So you're also going to have prosthetic training. A lot of times this is done with the PTs, usually a prosthetist. I hope I'm saying that right. But let's just say a prosthetic trainer, someone that specializes in prosthesis, let's just say that, will come and they will do the fitting with the person, take the proper measurements. And once the prosthetic is delivered, then the PT and OT will also work on training. Now, again, if you're in a skilled nursing facility, a lot of the prosthetic training is done with the PTs. However, you still do training as a OT when it pertains to functional use. So what does functional use look like? That can be donning and doffing of your prosthetic. That can be functional transfers on and off the toilet. That can be your ADL management. All right, so I hope that this video was helpful. I hope I give you guys insight on how to train your patient and how to help them manage their prosthesis. If you want to learn more information, of course, I don't specialize, but again, if you want to learn more, I definitely will do my best to answer your questions. Just leave it in the comments below, and don't forget to share and subscribe to this video. All right, till next time, bye-bye.